Life is all about the gray area undefined. Life is filled with parallels. You can have your cake and eat it too. You can choose to live your life out loud, or you can choose the in between or the middle of the road. Inside the gray area, that's where life happens. Welcome to Inside the Gray Area, sponsored by McGregor. Hi, I'm Leanne O'Brien. I'm here with Elizabeth England from the CAS Company. It's an organization of agents that work with individuals who are generally turning the age of 65 and contemplating a variety of insurance plans from which they want to enroll. We covered so much in our previous conversation, and today we're going to talk about Medicare Part D. Without further ado, Liz, I'm going to let you take the ball and run with it.
All right. Thank you, Leanne. Thank you again for having me back. There is so much to cover with Medicare. And so, as you mentioned, we talked about in the previous session, we talked about original Medicare Part A, hospital, Part B, doctors, outpatient, Part C, Medicare Advantage plans, and now Part D, prescription drug plans. I tell everybody Medicare is simple. A, B, C, D.
Yep.
Thank goodness
Wish
we
it
went.
was that simple.
Yeah. Thank goodness we went to kindergarten. So with the Part D plan, there are going to be some major changes this year for 2025. Next year for 2025
Okay.
that we will address this year during the Medicare open
Yeah, because
enrollment.
they're enrolling now for next year, right?
Yes, absolutely. So Medicare open enrollment is October 15th through December 7th. So we're getting the word out about these changes now because there are things that Medicare beneficiaries need to do now to get ready for annual enrollment. So what's happening? Okay. So the Medicare Part D prescription drug plan is being totally redesigned. It was rolled out in 2006.
Okay.
And now, due to as part of the inflation, oh my goodness, the Inflation Reduction Act, also known as IRA, um, they are going to be making changes to the Part D plan. So the Inflation Reduction Act went into effect in 2022. All right. And the main purpose is to lower prescription drug costs for people with Medicare, okay, and to reduce the drug spend that Medicare, that the federal government is paying, for that. So the Part D plan, the change will be effective January 1st of 2025.
Okay.
Okay. So what are the changes? Well, currently, the prescription drug plan has 4 phases. You have your deductible phase, your initial coverage phase, you have your you have your coverage gap phase, also known as the donut hole. I get people, they go, what's the donut hole? That's the donut hole. And then you have catastrophic coverage. So those are the 4 phases. All right. And they reset every year. Medicare is on a calendar year basis, January through December. Okay, so it resets itself every January 1st. So in 2025, the coverage gap, the donut hole, will be eliminated. And people are going to be happy because that's when you start paying.
That was very confusing.
It's very confusing and very expensive.
Yes.
Okay, so that is going away for 2025. And also, currently, your total maximum out of pocket spend for prescription drugs is $8,000. Well, come January 1st of 2025, it's being capped at $2,000.
Interesting. That's quite a difference.
It is quite a difference. So it's a really good thing for people that are high cost medications. Now, currently they're paying a maximum of 8,000. Come 2025, they'll be paying a maximum of 2,000. So that's a good thing. That is a really good thing.
And that has no impact as to whether or not you're a person who takes more expensive medications as opposed to one taking less?
That is correct.
It's across the board.
Everybody.
Okay.
Everybody will have a $2,000 max.
Okay.
So, some people, I have clients that don't take any medication. The $2,000 max applies to them. They just won't hit it.
Well, and based on the cost of medication today, and some of the newer medications out there even.
Oh, yeah.
That's got to be good news for everybody.
It's very good news.
Hmm.
It's very good news. I'm really excited. So since it is a law already into effect, we
Okay.
can start talking about it now. And
Okay.
that's why I had contacted you,
Sure.
because I wanted to make sure you're aware of this change. And I'll be doing Part D, Medicare Part D presentations like August, starting August 3rd, I think is my first one.
Hmm.
So I'll be doing a lot of presentations. So let's see. So the changes are, the phases are changing. So we're going from 4 phases down to 3, because we're getting rid of that donut
Donut
hole.
hole.
All
Mhm.
right. The gap, the donut hole, the gap, the coverage gap is going, so that's going away. I just screwed that up. But anyway, the maximum amount that you pay out of pocket, that's what I'm trying to get to.
Okay.
The maximum amount that you pay out of pocket will go from $8,000 this year to $2,000 next year, maximum out of pocket. And so, and then the other change that's coming about is they're adding a new Medicare prescription payment plan.
And what does
Aha.
that mean?
Yeah, what does that
Tell us
mean?
more about
Tell me
that.
more. So anyone that had, well, everybody's eligible.
Okay.
Everybody is eligible. The law requires that everybody get an opportunity to sign up for this payment plan. This is totally new. I mean, just totally new. So members with drug costs of $600 or more, they are likely to benefit from this new payment plan.
The most, probably, right?
Yes,
Mhm.
yeah. If you got less than 600, you probably don't want to go through the hassle of enrolling in the program. But if you have drug costs of $600 or more, it's
Mhm.
really what the target audience is.
Mhm.
You'll want to enroll in the Medicare prescription drug plan payment plan.
Gotcha.
Okay, so it's a voluntary program, so you have to opt in. You have to opt into the program. All right, which you can do during Medicare open enrollment in October,
Mhm.
or let's say sometime next year, all of a sudden you're on a high
A
cost
new
medication,
medication, yeah.
you will have an opportunity to enroll in the plan at that time. So what they do is they take that total drug cost and they spread it out over 12 months, or how many ever months it is.
So you can enroll anytime during the next year
Yes.
if, let's just, as you gave an example,
Right.
a medication for some reason changes.
Right.
Okay.
And it's more than $600. So currently today, what you do, you go to the pharmacy, they say that's $600, Miss England. And I go, ah. And I have to give them $600
Sure.
or I'm not going to get the medication.
Right.
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 So with this new plan, the pharmacist will say, but I see you're eligible for this new payment plan. Would you like to sign up for the new payment plan? And I go, yes, sign
So you
me
can
up.
you could sign up right then and
You can
there.
sign up right there and there at the pharmacy. The pharmacists are being trained on how to do this
that.
as
Okay.
well. And then so with that scenario, I will walk out with my medication. All right. And then
And not have to pay the
and not have to
600.
pay there at the point of sale.
Okay. Well, that's
Okay.
wonderful.
It is wonderful. And then the pharmacist or the pharmacy will bill my insurance company.
Mhm.
And my insurance company will bill me.
Okay.
They'll put me on a payment plan.
Right.
They'll put me on a payment plan, and then that way I'll be able to pay for that medication, spread it out over 12 months, 6 months, whatever, instead of
Mhm.
having to pay it, boom, right there, and I ain't got no money.
Yeah, because if that's a medication that you have to
Hmm.
have refilled, every 3 months or so,
Hmm.
by the end of a year, my goodness,
Right.
yeah,
They can put you on a
you
payment
could end
plan.
up being up around $2,400 or something somewhere. So, are there any medications that are exempt at all?
Okay, so with the Part D plan, there is a drug formulary. All right. And each insurance carrier, they have their own formulary,
Sure.
which is nothing more than a drug list.
Right.
Okay. So what might be covered under Plan A might not be covered on Plan B. And that's why we do a drug lookup when
Mm-hmm.
we're looking to see what plan is right for you.
Right.
So so each plan, they come up with their own formulary. So obviously it has to be, an approved drug. One thing that's not going to be covered are compound drugs.
Mm-hmm.
Okay, some people get those. They're not covered now. They're not going to be covered later.
Right.
So if it's an approved medication, it will be covered. I don't know whichever plan. So that's why we're recommending that you take a look at your medications now, so there's not any surprises.
Right.
So and I have a question. So once they pay the $2,000 cap,
Right.
so let's say they do it the first quarter of the year, is it free for the rest of the year? The answer is yes. Because once you hit $2,000,
Right.
that's the cap. So you
Okay.
don't have to pay anymore.
Okay.
So the bottom line is that the new Inflation Reduction Act has a lot of provisions in it that they believe can help make healthcare much more affordable. You hear about seniors talking about, I can't afford my medications.
Yeah.
I got to split my pills, and am I going to eat or am I going to get my drugs? So that's part of the reason why the provisions in this act it's started in 2022. They've done some things there. They made insulin $35 a month. That started a couple years
That's
ago.
huge.
Oh my goodness,
Yes.
absolutely. People couldn't get their insulin.
Right.
So now it's $35 a month. The government is in the process of negotiating drug prices with Big Pharma. They're doing like 10 every year to help lower drug costs. And so this is just another provision,
Sure.
this redesign of the Part D plan, which is really good. I mean, I'm excited, and I think not a lot of people probably, let's say in my book of business, will be affected, but I do have clients that have very high drug costs.
Sure.
Well,
Well, and for those of us in the aging services industry, we only hope that it'll improve the preventative side of medicine.
Right.
Like you said, for those individuals who previously would avoid, getting their medications, or they were splitting medications in
Right.
half.
Right.
Hopefully, this will lead to an overall better, healthful community.
Absolutely.
Yeah.
So they have that $2,000 cap, and they can spread that payment out over 12 months. And so I think that's a really good thing. So in closing, so how should Medicare beneficiaries prepare for the upcoming Part D
Right.
changes? So I have what I call the 3 R's.
Okay.
I amaze myself sometimes. Recommend.
Let's hear it. Okay.
We recommend you do an annual review of your prescription drugs now, because there might be possible changes to the formulary.
Sure.
Remember you just asked
Yep.
me about that?
Yep.
Well, with these changes, the prescription drug companies, they're looking at their formularies. They're seeing what they're going to cover, what they're not going to cover, and what tier is going to be.
Okay.
Okay. So I want you to go ahead and start doing a review of what the medications that you're taking. I need you absolutely to review the annual notice of change.
Okay.
It's called an ANOC, ANOC. Everybody gets that every year. The insurance companies are required by law to send it to you.
It's an acknowledgement. Yep.
It shows what your current benefits are, and it shows what your benefits are going to be next year. Nice little chart. 2024 benefits, 2025 benefits.
Okay.
That is the first step as we start working towards annual enrollment, because
Sure.
they have to be out by the end of September. Okay. So
Okay.
I've gotten my clients used to looking for that, so that, and they call me now and say, Liz, I already looked at it. You don't have to call me.
Okay.
You know what I
Well,
mean?
that's good.
That's exactly right. So that's what we want you to do, is to make sure. So look for it in the mail. It's going to come from the insurance company that you're currently enrolled in.
All right.
And you should have it by the end of September.
Okay. So we got to do that.
Got to do that. And then remember that if you're going to make a change, after you got all this information and everything, you have to do it during the Medicare annual enrollment period, which is going to be between October 15th through December 7th.
Right.
And that's every year. So start getting ready for that. It's the busiest time of the year for us. I'm busy all year.
That's
the
really
busiest.
busy.
Yeah, that is the busiest time. So if you'd like to learn more about the upcoming changes and how the changes might impact your Part D prescription drug plan for 2025, please feel free to give me a call. No cost or obligation. I'd be more than happy to help.
Excellent. Excellent. Well, thank you for that bit of good news. It's always nice to hear something that's in our favor for a change,
Absolutely.
right?
Absolutely is really good news.
Good, good. Well, I'm sure we'll be sharing that information with our residents, with our families, and with the community. So we look forward to partnering on that little tidbit of information.
Very good. Thank you, Leanne. I
Thank
really
you.
appreciate it.
Thank you for joining Inside the Gray Area. We're here to answer all your questions and share some interesting insights. I'm Leanne O'Brien. We look forward to seeing you next time, and be sure to follow us on social media and our YouTube channel.